wholehealthweb.com presentation on 6 things every person with inflammatory bowel disease must know. Inflammatory bowel disease is actually 2 diseases. Crohn's disease, which affects in spots throughout the intestinal tract, affecting deeply, and ulcerative colitis, which is usually contiguous, but only affects the lining of the intestine superficially. We want to stress to you that we're presenting you with research and information here. We don't want you to self-treat. We're just presenting ideas for you to discuss with your doctor. We're going to show you some lifestyle changes that can improve your health and symptoms, and remind you that you can go to wholehealthweb.com to read research and link to a practitioner who can help you. Ulcerative colitis symptoms vary on the extent of the disease. Sometimes it's only in the rectum. It's called ulcerative proctitis, and rectal bleeding may be the only sign. Proctosigmoiditis is a little more involved. The patient may actually have bloody diarrhea and cramping. As with left-sided colitis, will have those symptoms, but if it's more involved, as it is in left-sided colitis, there will be actually left-sided pain. Sometimes the entire colon is involved. That's called pancolitis, and you'll actually add weight loss and fatigue to the symptoms. Fulminant colitis is life-threatening, but it's a very rare form of the disease. Diarrhea is the most common symptom in Crohn's disease. As it gets more severe, there may be abdominal pain and cramping because of scar tissue and swelling. As it gets more severe, nausea and vomiting may be present. You may see blood in the stool. You may see ulcers, including the mouth, similar to canker sores, and poor appetite and weight loss. Complications from Crohn's disease can include obstruction of the intestine, malnutrition, which is actually a fairly common complication, development of fissures or tears in the intestinal tract, abscesses or pockets of infection, and fistulas, which is an abnormal tunnel that forms between 2 structures of the body. The scar tissue becomes so bad that different areas of the body actually join. Medical treatment can vary with the severity of the disease. Some patients are managed with anti-diarrhea medication. More severe cases are given steroids or even immune-suppressing drugs. When symptoms are severe, patients can be hospitalized, given IV nutrients, or fed liquid nutrients through a tube, which give the digestive tract a wet rest. Sometimes surgery is required, especially in Crohn's disease, if the scarring becomes bad and obstructs the intestine. Possible causes of inflammatory bowel disease include genetic mutations. In fact, there's a certain gene that tends to occur frequently in patients with Crohn's disease. It also seems to be associated with higher likelihood of needing surgery for disease. It can be caused by immune response. The digestive tract becomes inflamed, fighting off microorganisms. In fact, some believe that the disease exists because of an overreaction of the immune disease. The acne drug Accutane has been linked recently to causes of inflammatory bowel disease. Another drug, NSAIDs, non-steroidal anti-inflammatory drugs, haven't been shown to cause the disease, but they can aggravate it if you have it. These are the common painkillers like aspirin and ibuprofen and so on. Also, if you're taking a lot of NSAIDs, they can produce symptoms that are very similar to inflammatory bowel disease. Natural health care is especially useful for diseases that have exacerbations and remissions like inflammatory bowel disease has. A number of approaches can help. Diet, antioxidants, because these patients tend to be low in antioxidants, supplementation, vitamin supplementation, checking into food sensitivities. Some studies have shown probiotics to be useful, and stress reduction is also very good. Like most health issues, the first best place you should look at is your diet. Sugar, refined sugar especially, exacerbates inflammatory bowel disease symptoms. They've actually canceled studies where they were going to see how bad patients flared up when eating sugar, and they found that by giving these patients a lot of sugar, they flared up so badly that the study had to be discontinued. What a lot of people don't realize is that white flour, refined white noodles, white rice also acts like sugar in the body. And so these are foods that really should be avoided. Another dietary concept, this one's a little bit controversial, is that you can be sensitive to certain foods. This is different than food allergies. Food allergy, you think of eating a strawberry and breaking out into a rash immediately. People who are sensitive to foods very commonly eat the food day in and day out, and the food is the underlying cause of a chronic symptom. Irritable bowel or inflammatory bowel disease has been there's been research checking different elimination diets and with some success. And if you can find and eliminate food sensitivities, this helps many patients. It's worth mentioning the elemental diet here. An elemental diet is when you're just taking amino acids and fatty acids and being fed through a stomach tube. Food broken down to its elements that does not have to be digested, and this actually gives the digestive system a rest. And it's worth mentioning that it can outperform drug therapy. This is frequently done within the hospital, but it gives us the idea that not stressing the digestive system can possibly help these patients. Which brings us to another controversial diet. This is from Elaine Gottschall, who created a diet called the specific carbohydrate diet, and her idea is that complex carbohydrates, not simple carbohydrates, so like sugar found in fruit is acceptable, but carbohydrates that are in the form of starch or what they call disaccharides, like table sugar is a disaccharide, lactose in milk is a disaccharide, things that have to be broken down, carbohydrates that have to be broken down by the digestive system, can be an underlying cause for inflammatory bowel disease. And the way this happens is that we eat so many complex carbohydrates that we don't adequately digest them. They go into the digestive tract, bacteria grow, our immune system overreacts to the bacteria, and that further hurts the absorption and breakdown of the materials. So Elaine Gottschall's solution for this problem is to completely avoid any complex carbohydrates. That includes rice and beans and bread, wheat, any kind of starchy foods, and also disaccharides, table sugar, certain cured meats will have that, milk, dairy products, and things like that, and give the digestive system a rest. And this approach does work for a number of patients. The fact that it works for some, similar to an elimination diet, but not all, tells us that there might be several different mechanisms depending on the individual for this type of a problem. But it's definitely worth looking into. The book is Ending the Vicious Cycle. The author's name is Elaine Gottschall, and you can do a search and find her online. It's worth mentioning vitamin deficiency. Because of poor absorption, drug therapy, and other reasons, inflammatory bowel patients tend to be very vitamin deficient, and supplementing can be a good idea, but if the digestive system is really touchy, they might not handle vitamin pills particularly well. There are liquid vitamins. You want to get folic acid, which you would take as a separate liquid. Sometimes the vitamins have to be administered IV. This is something to discuss with your doctor. And also, interestingly enough, the more deficient you become, it can actually exacerbate and make the absorption worse. Among the nutrients that these patients are short of are antioxidants, which are vitamins and different phytochemicals and things that actually protect the cell. It's almost like chemical warfare is going on in there, and if you can get antioxidants, even something as simple as vitamin C, it might help the disease go into remission. Juicing fresh vegetables is a good way of getting antioxidants, but once again, you have to see what your digestive tract can tolerate. And there are some studies that show probiotics are useful. These are normal. This is normal colon bacteria. You can look on Whole Health Web and see research to this effect. And stress reduction is also very useful. Flare-ups happen during times of stress. At wholehealthweb.com, we have some MP3 files, some recordings of self-hypnosis, stress reduction, NLP type exercises that can help you. So this has been a presentation of wholehealthweb.com. Our purpose is to give you information and research, not to have you diagnose and treat yourself, just to give you some basis for a discussion about natural health care with your doctor. We hope you enjoyed it.